So I am currently working on an A3 project that is aimed to improve some of our compliance and quality measures. This process was found to have some needed improvements through a routine chart audit. Medicare requires that we get a physician signature within 30 days, and on this routine chart audit we realized that not all plans of care were getting signatures. The reason that that's important is so that we don't have any delays in patient care, and that we also don't lose any reimbursement. Once we identified that we had a problem, we started to do a root cause analysis. So that basically is breaking down why is this happening smaller and smaller until we finally get to the root of it. And we discovered that we did not have a standard process written out to divvy out who was supposed to do what at what time frame. So we started with mapping out our process on sticky notes. So at the very baseline, it would look something like this, where we're writing these sticky notes out and moving them around and mapping out our process. And that's where we could find that there was some breaks in the process or parts of the process that were not assigned. So after we mapped this process out with sticky notes, I sat down with some other staff members and asked them what part of the process they owned, what their understanding was of the process, and how they felt we could make it better. So we turned that into a step-by-step working guide where we just listed out every step that needed to happen. And we discovered that there were several other departments that were really involved in this, so that meant reaching out to the HIM department. We also talked to Methodist 84th Street campus in Omaha, our peers, and asked them what their process looked like and who handled that. So we really sat down and mapped out dates and times and who was going to own each part of this process until we finally discovered where we had missing components at, and we could assign those out and create our new process. So the new process then went from being sticky notes to turning into a mapped out process and what happens under certain conditions. And we've gone through several iterations of that now until finally we get a clean process where anybody could pull this process up. And we could use it for training. We can use it to show new employees, like, these are the steps, and you can go easily and get that. And if we ever do run into problems again, we can backtrack and find out where in that process that things were broken. So we are about a month into this process. After a month of trialing this, we went back and looked at our list of plans of care that needed signatures and realized that we still had room for growth. So we went back and looked at our process one more time and collaborated with our peers at 84th Street campus to see again where we might be doing things a little bit differently, and collaborated and have got really a good system going now. So we'll watch it again for another month. We did find after some collaboration that maybe that we still had a more global piece of the puzzle that was missing, of how to handle this if we are unable to get a signature after multiple attempts. And so now that question is going to move on to our compliance rehab subcommittee, and the directors of all the rehab departments will be able to give and share their input, so that hopefully across the health system we're all on the same page and have this really nice process to be able to tell people how to handle this situation when it comes up in the future.